always say, treat the patient and not necessarily just treat the problem. You mentioned, Professor, earlier that in the past it was like a singular anatomical unit, and in aesthetic medicine it could be lips, it could be body sculpting, it could be anything, but all of us are medical professionals and we learned a great consultation approach, and even if we've left hospital medicine and evolved into different regenerative, longevity, aesthetic specialities, we still believe in the art of the consultation, irrespective of the body part we're treating. And I think we can easily recognize a red flag patient, which we're not talking about today. We're actually just looking at our patient and discussing and trying to ascertain their emotional well-being, whether it's for lips, whether it's for nose, whether it's for anything. So we should be able to take a deep dive and just ask further questions and probe with 3 simple questions. How actually are you? You know, when's the last time we actually asked our patients, how are you? And that takes it away from just how they look to how they feel, whether it's breast reduction, whether it's tummy tuck, whether it's anything. And increasingly so, as you said, Professor Tracy, after COVID, we're just seeing this increasing crescendo and epidemic of people just feeling increasingly overwhelmed and increasingly emotionally burdened in a good way, smothered with gratitude. We get to be here, we get to practice, we get to do what we're designed to do as doctors and nurses and healthcare professionals. However, the increasing chronicity of the stress, the burnout, the overwhelm, the renormalization of that burnout and overwhelm. Our patients are just going and going and going. So it's this chronic inflammation that, as Professor Tracy said, you can see on the face, the redness, the rosacea, the disrupted skin barrier, the broken down, functionality. So for the first time, we're looking at not just how people look, but how they feel, as well as their functionality. And you could almost see this patient walking towards you, and when you say, how are you? And when they say, fine, you know it's not fine. It's not okay when someone says, I'm fine. So that for me is enough. So for me, it's that perfect blend right now to make that quick decision and say, I truly have something that can connect with you in a self-perception very quickly, very safely, in something that has been trial tested with medical data and that I can use in my own practice, like you, for over 10 months now, that can make you feel really fine.